Awesome. Real talk about sleep. So we're going to get into a little bit of sleep coaching. Before we get into that, we're going to cover some myths. We're going to do a lot of things today. Actually, we're going to learn a little bit because it's very important that you go through all of the steps. But this is for anybody at any stage. So if you are a hygienist and you consider yourself to be only a hygienist, you don't do Airway, you don't do Myo, you don't do anything related to that, fine. No worries. This is still for you. If you are a myofunctional therapist, it's always good to learn. And so there might be some new gems in here that you're unaware of. And so, yay, this is also for you. It's really going to cover the grounds for everybody. This is a talk for the International Association of Airway Hygienists. It is open, so we do have other people who are not members here. However, it is a fabulous organization that is built to support you, hygienists. It's by hygienists for hygienists. It is a passion project that I've been with and on since 2019, and I am so excited to share more with you about it. If you have any questions, just put them in the chat, and I'll be happy to let you get my email address and you can learn more. Okay. All right. So who am I? After all this time, I've just been talking and rambling and ranting, and you have no idea who it is that's even lecturing to you today. I am Carice Laguerre. I am a myofunctional therapist only. I don't do any clinical hygiene anymore. I have a practice called the Myo Spot. I practice in New Jersey and in South Florida. I'm actually in New Jersey right now. I do. So it's not just, talk. I really do travel back and forth and I do both. So I am in New Jersey right now. I have books. I've been on podcasts. I've been on stages, both nationally and internationally. And I am just so happy anytime I get to talk about myofunctional therapy because there's a little bit missing where every time there is some talk about myofunctional therapy or airway, there's some sort of gate, right? Like this little paywall, and it feels like you have to do something or put something in a bucket before you can learn some information. And I just love to give freely. And so wherever I can give, I'm happy to give. And so hopefully I'm able to infuse just a little bit of my knowledge into yours. And then I like reciprocity. So if there's anything somebody can teach me, let me know. Okay. Let's cut into the boring fine print, snooze fest, right? Okay. We have two main objectives. We're going to cross both objectives today. Okay. One, we're going to identify three common sleep myths. There's so many, but we're going to identify three main ones. And those we're going to debunk at some point. Like, we're really going to get into what's the nitty gritty of why those are myths and bust them. Then we're going to develop strategies for beginner level sleep coaching. And by beginner level, I mean like you're a hygienist or you're not, like if you're a myofunctional therapist and you're not a certified sleep coach or you haven't taken any sleep coach, education, I don't know. It's beginner level. It's like real entry level. Okay. All right. Now, content. Does any of this sound familiar for either yourself or for a patient that you may know or a loved one? Throughout the day, just feel like you're not at 100%. You're functioning on significantly less than full. You are experiencing daytime fatigue or difficulty concentrating or impaired memory, where you're just kind of not quite sure what it was that you had for breakfast yesterday. You have mood swings that are random and maybe unexplained, and you just can't put any rhyme or reason to it and why it's happening. You are experiencing poor decision making or less than optimal. Maybe it's not poor, but less than optimal decision making. Decreased immunity, where you're getting sick more frequently and you're like, I don't understand why that would be happening. Or you feel a need to nap or take little micro sleeps. Does that sound familiar to anybody? Just give me a quick yes or no in the chat if it doesn't sound familiar, if none of those things sound familiar. I'll wait for a second. Let's see if anybody's actually paying attention. Okay, great. Awesome. People are paying attention. Awesome. Okay, here's the problem is that it's super familiar to all of us as it should be because sleep deprivation is incredibly common. Okay. The CDC in 2015 indicated that sleep deprivation is a national, so in America, national epidemic. But then the WHO, World Health Organization, in 2019 doubled down and called it a global epidemic, that globally we have about 40% of the population struggling with sleep deprivation. So America, 1 in 3, the world, 1 in 4. People are experiencing sleep deprivation at high levels. And we don't want that. We don't want that. It's not good for us. It's not good for our patients. We don't show up well when we're not sleeping well. Our patients don't show up where they have to show up and how they have to show up well. Sleep is essentially the biggest thing that we do. We spend 1/3 of our lives sleeping. We know that we need it for restoration. We know that we need it for brain health, for cognitive function. We know that we need it for our bodily functions, to restore cells, to allow the brain to cleanse. We need sleep. But for as much as we know about sleep, and if any of you have read Matthew Walker's book, we know a lot about sleep. We don't know very much. Okay. And I like that he kind of opens up the book like that. Like he's a PhD level researcher on this topic, wrote an extensive, almost 400-page book about sleep and why we sleep, but we really don't know much about sleep. So surprisingly, you'd be surprised to know that, we still have not pinpointed why scientifically sleep has even evolved to be something that we need to do. It's really inefficient if you think about it when we lie down to go to sleep. If you were thinking about the ancestors and you're thinking about early ancestral times like cavemen or whatever, if they were to lie down, not really any shelter, or their shelter might be a cave where there could be other predators or there's easy access for predators to people, it's inefficient to spend 8 hours sleeping. You could be in perilous danger. It doesn't make any sense, but we need it. We need it for our body. Animals need it for their bodies. Like sleep is essential. So, for as much as we know about sleep, we don't know very much. And I'm going to help you just kind of refine a little bit of what you do know, because it's incredibly important that you know what the problem is if you're going to address it through any type of sleep coaching. Okay. So here's how I like to think of sleep when it comes to our brain health. Okay. Imagine, hopefully, everybody here does laundry at least sometimes. If you don't, I want your life. That would be great. Laundry, if you're putting in fresh clothes into your laundry, your washing machine, your washing basin, if you put in clothes and you fill it up, once the cycle runs and it rinses and the clothes are all wet, it almost looks like it's not nearly as full. In fact, there's more room there. And with that extra room, you could shove more clothes in if you needed to. Like if you forgot about this load or you just like, yeah, I'll just dry it all together, you could just shove some more clothes in there. And if you shove some more clothes in there, you could wash that load. And probably after that load, it might look like you could shove some more clothes in there, right? But how efficiently are we cleaning these clothes? Like, are these clothes going to be the cleanest clothes that we could possibly have? Probably not. Like, it's less efficient, right? So, sleep deprivation is kind of like every night you're not getting enough and you're just trying to shove more stuff into your brain with memory or new tasks or some new cognitive function that you have developed. You're trying to shove more into the brain, but you never really emptied the washing machine. So you're inefficiently allowing your body to function. Like your washing machine wouldn't benefit from you doing all of that. Your clothes don't benefit from you doing all of that. There's nothing efficient or purposeful in washing clothes by just shoving more into the machine. In that same way, there's nothing purposeful in carrying on sleep deprivation, hoping that you can catch up. You'll never catch up. It won't be as efficient, right? So when we think about that little example, what it actually triggers for me is like an old commercial. Okay. In the 80s, this was a thing. This is your brain on drugs. They would have an egg and it would be, this is your brain. And then crack into a frying pan. This is your brain on drugs. Well, let's take a look at what your brain on sleep deprivation is like. Okay. Hopefully this will play for me.
You watched cat videos all night. Now you can't seem to shake the grogginess and struggle to complete basic tasks. Your sluggishness mimics your brain's performance after a night of no sleep. As you try to stay alert after little sleep, regions across your cortex or the outermost layer of your brain are not as active as normal. Lower activity in your prefrontal cortex makes it harder to process moment to moment information and react to your surroundings. What's more, reduced signaling in the visual cortex and intraparietal sulcus challenges your ability to integrate visual information and coordinate it with your movements. Diminished activation across the parietal cortex hinders your capacity to keep track of temporary information. It also disrupts your ability to retrieve old memories and learn new information. When all these areas slow down, it may be harder to complete tasks that require your attention and stay in a good mood. Sleep deprivation over longer periods of time can reduce your brain's ability to form long term memories and hinder your ability to dispose of waste products building up in your brain. Even if you may not feel tired or sleepy, it could take days for your body to fully recover from lost sleep, which may be a good enough reason to stop scrolling and aim for a full 7 to 8 hour night's rest.
So while I love all the information that was in that video, that's 7 to 8 hours. Ooh, I can't wait to talk to you guys about that. Anyway, your brain on sleep deprivation is not nearly as efficient as it should be. And considering the fact that globally, 40% of the population, doesn't matter if it's an industrialized, if it's a first world country, third world country, 40% of Earth's population of humans is experiencing sleep deprivation is a problem. That is more difficulty with simple cognitive tasks, learning, focus, memory, reaction, the ability to walk and talk. Sometimes you're in a walking coma where you're not actually functioning, you're just existing. You're awake, but you're really not awake. It's like you're drunk without ever having taken a sip of alcohol. Okay. So it causes a lot of disturbances along the brain, and it's really just important for so many functions. So, how do we learn about sleep as people, and how do our patients learn about sleep? Because really, this is all about how you coach them. And the information that they're getting, is it similar to the information I just presented? Well, we think about where they are processing information. There's social media. So they might be on the TikToks or the Instagrams or the Facebooks or wherever, and they're ingesting that information. And if you've ever been on social media and seen something that was absolutely flabbergastingly incorrect, just give me a yes in the chat, because I think we all know social media is not always the most reliable source for information. Well, nor is sometimes the information that we get from our loved ones, our neighbors, our friends who will talk to us and who will say, hey, I really am, it's so interested in learning more about sleep. And I just saw this TikTok video and it said that if you sleep upside down, that it really does help. And so you need to change your position and stop sleeping with your head at the headboard. Your feet should really be at the headboard. And then you need to take out the pillow. And that's what I've learned. Like, all sorts of ridiculous information. Sometimes they give you really great information, sometimes they don't. Okay. Other times you might be getting it straight from your physician. It might be an ENT, it might be a pulmonologist, it might be a sleep physician, it might just be in general, like your primary care physician who might be giving you information. But I think we all need to remember that the same amount of education we got about airway in hygiene or dental school, no matter what you're watching, um, the same amount of information we got while we were there about airway, they probably got that or maybe a minor amount more in medical school on sleep. So we're all generally not very well educated. But then what do we do with some of that information? We go and we look for things. We shop and we buy and we do all of the things. And it's a vicious cycle of misinformation and consumption that I think we all need to get off of that hamster wheel. So, how is it that we can best get, and by get sleep, I mean like understand it, best comprehend sleep? Personally, I think it's you. It's the airway hygienist, it is the dental hygienist, it is the myofunctional therapist, it is the person who is actually investing the time in education. Hygienists are seeing people for far longer and far more frequently than any other healthcare provider. Myofunctional therapists are spending time on education. All I do as a myofunctional therapist is educate people all day long. I don't have a day where I don't have to answer the question, what is myofunctional therapy? Every day, if even that's the only thing I'm educating on, that's the thing. Okay. So we have the time, we have the frequency, we have the capabilities because all of your skills clinically with patient education, with building rapport, with everything that you know that you've learned in order to obtain licensure, absolutely it is the hygienist, the myofunctional therapist, the airway hygienist who is primed for this. But if you're going to be providing education, if you're going to be coaching your patients or clients on what they need to do, there's three important things that you absolutely have to understand. And so that's why we kind of started out the way that we did. Okay. One, you need a solid understanding of your topic. Like, you have to know sleep, not in and out. Because, like I said, there's not a whole lot that we actually do know about sleep, okay? But you need to have a solid understanding enough that if they have simple questions, you have simple answers, okay? So you have to be able to understand and repeat back this information. Two, you have to know what they know, like what is out there. And that's why we're going to discuss some common myths, because these are probably going to be like the top three things that you will wind up discussing. However, there's a multitude of myths around sleep. So trust you will get hit with some things. But for the short window of time that we have, we're going to discuss at least three things that you need to know that they think is true, but it's not. Okay. And then a variety of ways to get to resolution because there's no one path for everybody. I don't believe in cookie cutter anything, but specifically when you're coaching or doing anything therapeutic, there's no way that one solution is going to serve everybody. So, yes, you might like a certain tool. You might love a replenish straw. You might love a nasal strip, but these things are not for everybody. They don't service everybody. So, how do you know what to give and to who, when to recommend, and when to wait? We're going to get into all of that. Okay. So, before I give you my three top sleep myths, I would love to know what's one myth that you hear often or that you believe to be a common myth. And I will actually wait for these. Okay. So please give me a myth. Just let me know something in the comments that you've heard and you're like, wow, that's really bizarre or way off, or like I can't believe that people really think this. Just gonna wait it out because I'm sure people are. I only need 4 to 5 hours of sleep a night. Okay, I love that, Terry. Thank you. Yes, that's a myth. I think I think that will come up. We're gonna get that. I like that. That's a very common one, and I wrote about it in my book. 4 to 5 hours a night. Kevin Hart and Vince McMahon, two very famous people who are very, very busy and who do a lot and who have become incredibly wealthy and so forth. They very famously purport 4 to 5 hours is all you need to be successful. CPAP is the only treatment for OSA. Oh, what a big myth. Thank you, Beth, for that. That is. I drink too much water, so I have to wake up to pee every hour. Oh, yes. Hallelujah. Thank you, Catherine. That is a big myth. It's not about what you're drinking, when you drink it, why you drink it. I have a story about my daughter. I don't know if we'll get into it, but if I have time at the end, remind me and I will share. And same thing, Kelly. Awesome. It's normal to wake up to pee during night. Very good. These are some really good ones. I'll tell you that grinding is from stress. Thank you, Cheryl. Catch up on my sleep over the weekend. Yes, never catch up. And grinding, we we honestly don't know what's the cause of the bruxism, but as far as evidence-based things, and I don't get into it here, so I'm just gonna give you a little glossing over of it. But as far as evidence has shown, a lot of bruxism occurs after you've had an apnea. So after you've had an apnea, and you start to go back to sleep, the body goes into some of that. And so it could be from stress, but that's induced based on a sleep apnea or a possible, you know, uh, apneic like event. Okay. First myth that I'm going to present, because you guys had some really great ones, is that snoring is normal. I think that is a common, there we go. That's a common one that I hear a lot. Like, oh, but it's normal. Everybody snores. Like, don't you snore? Like, yeah, everybody snores. Well, common and normal are not the same thing. And so it's really important that we really, really specify what is what. Okay. So, common isn't even always that common. The prevalence for snoring is about 25 to 50%. They can't even narrow it down any less than a 25% gap. That is wild. But if it was like a 75% prevalence of snoring, then okay, it's pretty common and therefore might gear or skew a little bit more towards normal if like a high population is doing it. But it's 25 to 50%, and we can't even zone in on like what it is in specifics because we just can't collect the data on that. There's not enough that we know about sleep, guys. What we do know is that men are more likely to snore. Weight has a big, big influence on that as well. Not to say that, smaller people don't snore because they do and they can. And age, you're more likely to snore as you get older in age. So snoring isn't normal. It is common, and there are factors that lead into it. Those factors are very similar to a lot of other health things. Like you're more prone for heart troubles or for type 2 diabetes if you are obese, if you are older and your diet is containing a certain number of things and your cholesterol is too high. Like you're more likely to be prone to heart disease or type 2 diabetes. But just because a lot of people are suffering with and are, dying from heart disease and type 2 diabetes and complications of type 2 diabetes doesn't make any of that any more normal. And so we don't want to consider snoring as a normal thing. What we do want to look into is the impact that it would have on something really important, our sleep cycles. Okay. So when we're cycling through sleep, it's a very cyclical thing where about every 90 minutes or so, we're kind of going through the motion. Stage one sleep is a really light sleep. And so you're going to spend about 5% of your time in stage one sleep. Now, if you've ever watched a movie or put on TV, and I am so guilty of this all the time, or you put on something and you're fully intending to watch. It has nothing to do with the fact that it is boring or you're not interested, but it comes on and at some point you miss a little part of it, but you don't even remember going to sleep. You wake up and you have no idea that you went to sleep. You just feel like the movie just kind of skipped forward a little bit. You're like, what happened? Or somebody wakes you up and it's like, hey, you were sleeping. You're like, no, I wasn't. You were in stage one sleep. Okay. It's just transient. It's just a very light era of sleep. Stage two, and that's when the blood pressure and the heart rate start to come down. Stage three, max relaxation. Like all the muscles start to relax. Your heart rate is at its lowest. Human growth hormone is secreted during this stage, and it'd be pretty tough to wake you. If you are finding that you're a light sleeper, you might not be fully getting into stage three. You might be hitting stage two, do a light pass over of stage three, which is supposed to be about, you know, 20%, I want to say 20% of your sleep, because I know 5% is stage one, 25% is REM. So about another 20% would be your stage three. If you're not hitting it and you're hitting it maybe at only 5%, and then maybe you're cutting through your REM, which is where dreaming occurs, which is where full restoration happens. Like we want to be in that REM. You're not going to be a deep sleeper if you're not holding in that stage three and then reaching paralysis, sleep paralysis, and our REM. So the sleep cycles are incredibly important for restorative sleep, for restoring sleep so that we're not functioning in sleep deprivation. Because you could be asleep and you could kind of hit some of the stages or wake up in between some of them or have your snoring, which is really the sound of air meeting resistance as it's going through your airway. And if you start to say it like that, it sounds really problematic. Airway is not functioning for air to pass through. That's pretty problematic. Another way of saying it is that, yes, like it's the vibration of the soft tissues, whatever, but that doesn't really sound very alarming. It actually sounds like it might be very interesting. I might want to see that. Like, oh, my tissues vibrate. That's cool. But air is meeting resistance as I'm trying to get it from outside of my body to inside of my body is a problem. So sleep cycles, we want to cycle through them appropriately, and any disruption with a closure of the airway or obstruction of the airway is going to alter this rhythmic state that we're supposed to be in. Okay. And so when it's altered, that's when we hit all of these big repercussions of sleep, where we're in sleep deprivation, we're experiencing all these various signs. Okay. Sleep disordered breathing is that big umbrella term that encompasses a lot of things, but essentially it's going to be that pattern interruption of the sleep where we'll onset, airway will collapse, our breathing will pause, and now we're awake, we're coming back down, airway collapse, breathing pause, now we're awake, and it just cycles through. So instead of going through our wonderful rhythmic motion of sleep cycle staging, we are interrupted, 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 and absolutely nothing beneficial happens for us. So if that's the case, that we're struggling to breathe while we are sleeping, and that's what's so normal, snoring, right? And that's what's so normal to everyone, then we need to start thinking about it as a abnormality due to airway collapse. And I like to liken it most to Newton's third law. So if you guys remember anything from like science or physics or whatever, Newton's third law is for every action, there's an equal and opposite reaction. So if you're not breathing well, if you're hearing the sounds of you not breathing well, air meeting resistance going into your airway, going through your airway, if you're not breathing well, you're not going to sleep well. Okay. And so, boom, that creates a wonderful, nice combustion for sleep disordered breathing, which encompasses all of these things as like an umbrella. So as far as I'm concerned, snoring is normal is a myth that we've busted. Okay. Sleep issues are easy to resolve. This is a big myth that I hear all the time. There's so many things I can do for my sleep. I don't need to do X, Y, or Z because I don't have a problem. Or if I did have a problem with sleep, it's easy. I just buy a new mattress, or I'll just get another pillow, or I'll put on some white noise. Or what's the thing that the kids are listening to? It's all the little sounds of people like they will like tap their nails or whatever. You guys know what it is. Somebody can put it in the comments if you know what I'm talking about. But they think that they can do all these things. And really, most of the things aren't going to help because at the end of the day, if you have a great pillow, if you have a great mattress, if you have all the white noise in the world, if you have stopped looking at your light and you have no blue light exposure, which is also another myth, but we'll get to that in a little bit. Um, if you have no blue light exposure, but your airway is still obstructing and you're still going to sleep and you snore and you're still going to sleep and you have sleep disordered breathing, well, it doesn't matter. Your mattress doesn't care. Your body is struggling to breathe. There are some resolutions that people typically do to help them fall asleep. Sometimes people will do caffeine and then, think that it's just going to keep me up for a certain amount of time. And then that fatigue will kick back in at the end of the day and everything will be great. No, that is wrong too. I'll give you some more information. We'll dive a little bit more in depth into that in a second. Some people think if I just have a glass of wine before bed, awesome. It just puts me right to sleep. And I so identify with that because, if you contacted me 9 years ago, I'd be like, yeah, like that's what I need. I need some wine before bed. And that's all. And that'll help me go to sleep real fast. So I can identify with that, but it's wrong. It's complete misinformation. And taking drugs, any sort of pharmaceuticals or drugs that will help to induce sleep don't actually induce sleep. They're more like sedatives. But let's dive in a little deeper into the caffeine and then we'll get into the alcohol and the prescription medications and how all of that is really a false answer. Okay. So, caffeine. Caffeine is a stimulant. It's going to help keep you away, okay? Help you keep you awake. But the fact that it's helping to keep you awake is not something that you can use to help you induce sleep. It's actually just going to be incredibly disruptive to your circadian rhythm. Your circadian rhythm is how you're actually managing, your body is managing sleep. When to produce hormones of sleep, when to produce this waking and stimulation. Okay. The half life for caffeine is 6 hours. I think most people don't think about that. If you think about a work day, that's about 8 hours. You wake up first thing in the morning, you have coffee, or you get to work and you have coffee, or with lunch, you have coffee, or after dinner, you have coffee. Like that is still in you. That caffeine is still in you for 6 hours until the half life. Okay. The half life. So it will impact your sleep quality. If you're going to have it, just everything in moderation, right? Like I wouldn't wake up and have a piece of cake every single day because the sugar is going to keep me awake. Everybody would tell me that was wrong. And the more that I do that, the more I'm going to get adjusted to the fact that I'm having this level of sugar and I might want more or need more to get the same effect. It's the same thing with the caffeine. So you just want to be really, really moderate with it. And the more that people work on their sleep, and when you do actual sleep coaching, like beyond beginner level stuff that I'm going to tell you, people do find it easier to wind down off of caffeine. I will tell you that caffeine withdrawal is a real thing. So is sugar withdrawal, where they do get headaches and will complain of irritability and so forth. Like it's a real thing. Okay. If you haven't had your coffee today, you might be in withdrawal right now. You might be like, I get it. It's real. Alcohol and prescription drugs, sedatives. These are sedatives. So when you go down for an operation and you go down, a lot of people like to say that the anesthesiologist is putting them to sleep. You are not being put to sleep. You are not cycling through any sleep stages. You are not getting any restorative properties happening while you are there. You are being sedated. You are essentially being put into like a coma. Okay. And if you think about it in that way, your Xanax is not helping you to get to sleep. Like your medications are not helping you to get to sleep. They're helping to sedate you. And if you want to be sedated, that's fine, but you're still going to be operating from a space of sleep deprivation. And that is in and of itself going to perpetuate other problems going on. So it's also going to be alcohol specifically relaxes a lot of the throat muscles. And so that's going to be a contributing factor for the increasing the probability of you having a collapsible event or an apnea or a hypopnea during the evening, during your sleep. So these are not things that you need to be using or trying to use to supplement. These are not things that you should recommend for your clients. And that would be something that I would highly recommend you discuss and learn a little bit more about. That way you can discuss with confidence with your patients. Supplements. A lot of people take supplements so that it can help them get to sleep. Melatonin. I mean, the biggest problem with supplements is that we don't know, they're not regulated by the FDA in America. So we don't know what exactly is in it. We know what it says on the bottle, but that doesn't mean that that's exactly what's inside, number one. Number two, with things like magnesium, we don't know that it's passing the blood-brain barrier because GABA is a big part of why magnesium helps to induce relaxation. And GABA has to cross the blood-brain barrier, but we don't know that if you're taking an oral supplement that you are able to get that magnesium to cross the blood-brain barrier. So like people are taking these things and sometimes it's a placebo effect. Like you have no idea what's going on. So you're taking a supplement, you might become dependent on that supplement, particularly the melatonin, and your body starts producing less because you've got artificial melatonin that's there. And then you're not getting the same effects. We don't know what's in it. We don't know if it actually can work the way that it's supposed to work. And your body will not react in the same way to be able to produce the same hormone or mineral that we need to actually utilize within our body naturally. People do infuse certain scents or diffuse scents, or whatever you want to say, if they're infusing it into their air ducts and their system. Some people do infuse scents like that, or you could diffuse using like a mister or whatever you would use to diffuse certain oils. Uh, Most common is chamomile and lavender. I have heard of magnolia bark also being involved. And some people say that they've used vanilla. Like I've seen a couple of things. And so it's very, very interesting the things that people will do to help them with their sleep, but it's not consistent. Okay. And then there's always this whole thing with sleep. So everybody will say you need to turn off your TV. You need to get rid of your phone like an hour or so before bed. Stop looking at that blue light because that blue light is going to damage your ability to naturally produce melatonin. Well, guess what? All lights are blue lights. Okay. So it's not just your phone that emits it. It's not just your television. It's not just your computer that emits a blue light. It is the bulbs that you have around your home. They emit blue light. So when the sun goes down and you really want to get blue light out of your life, well, you have to mimic as much as possible natural tones. So when the sun starts to set, you get that red or that amber tone. You can mimic what happens with your body by having a red bulb. So red bulb, and not like a party bulb, although the party bulb might do the same thing, but there are actual red light bulbs that you can screw in that will produce only a red spectrum and there will be no blue light in there. And then yay, that is your one natural way. But if you have your light on, you might as well have your phone on.
Told to get rid of this 1.5 to 2 hours before bed. What they don't tell you is that this and this are the exact same thing. If you have your lights on, you may as well use your phone. What you have to do to get better sleep, get rid of phone.
Yeah, what you have to do to get better sleep is get rid of both. So like I think what we're learning 100% is that it doesn't matter what you do. There's so many things to do. Sleep is not easy to change. Sleep is not easy to improve the quality of. A lot of what's out there as information is not always the most accurate, and there's so many things that people are struggling with. Circadian rhythm would be most likely the biggest thing. Like they're not regular with sleep. Consistency is a big factor. If you're going to naturally regulate your sleep, you have to be consistent. A lot of times, if any of you are parents, when somebody is giving you advice, they're imparting their best advice for you and your baby. More often than not, it's going to be routine. Your baby needs routine. Get them on a schedule. If you don't get them on a schedule, your life's going to be miserable. Guess what? It's not just babies that need routine. Kids need routine. Teens need routines. Young adults need routines. Adults need routines. Older adults need routines. We all need routines. And the only way to establish your circadian rhythm is to have a routine around sleep. And that's not easy to do because we all have very busy lifestyles. We all have things that are very difficult to change in those lifestyles. So it's not just changing one or two things, it's completely revamping your whole life. It is making a change on a grand scale. It is changing your entire lifestyle, and that takes time. Okay. Short rant that nobody is asking me for. Hey, Carice, how come you didn't mention anything about mouth tape? Or how come later when you talk to us about sleep coaching, you're not going to mention anything about mouth taping? Great question. Really glad that you guys asked. I compare mouth taping, that's not to say that it doesn't work, because literally all things work for some people, some of the times, including placebo. Okay. So it's not to say that mouth taping doesn't work, but I've got a nice little analogy that hopefully will allow you to think about it just a little different. Okay. Sometimes people don't know where their obstruction is coming from. We don't know if it's nasal. We don't know if it is, pharyngeal. They are having struggles. And sometimes we don't know, as the practitioners we are, hygienists or myofunctional therapists or airway hygienists, we have no idea what the source is. Okay. We're not able to scope. Sometimes maybe they haven't seen an ENT. Like we don't know what's going on. Okay. We can't do a drug induced sleep endoscopy. So we have no idea. So closing the lips is kind of like snipping the frenum. If you think about a tongue tie release, if we just snip the frenum cosmetically, oh, yay, looks better. Functionally, nothing changed. Nothing could change. The lips are just like this outer portion. So yeah, their lips are closed, but who's to say that they have full capacity to breathe through their nose? I don't know, you don't know. We don't know where the obstruction is coming from. We don't know what the musculature looks like here. Like, why are we closing up these lips? It's literally like a snip of the tongue for a frenectomy. I don't know. That's my thing. So, small rant, nobody asked about, but as far as I'm concerned, sleep problems are easy to resolve. That's a myth that we've busted. Okay. All right. Next. 7 to 9 hours is a required amount of sleep. Like there is a requirement on sleep. That is a myth. I think a lot of people, because people say it enough times, you feel like it's true. Like if I just say something enough times, everybody's going to believe it's true. And that's not the way these things work. So yes, babies do need more sleep than like as we age, we require less as far as restorative functions and being able to restore in a certain amount of time. However, research on sleep and sleep duration really only originated in the 1980s alongside the invention of the CPAP. So sleep is still in its infancy. Sleep in its totality is in its infancy. And if you think about what was going on in the 1980s when they invented the CPAP versus what's happening now, two entirely different time frames. Nobody had a bunch of electrical devices. Like nobody had cell phones on them in the 80s. Nobody had computers. We weren't doing all the things that we do now with this extended broad length of blue light and exposure to electromagnetic frequencies. Like, we didn't have all this stuff, okay? People were not working at the same rate that they're working now. People are working now harder. We need that two-income household. Not to say that that wasn't needed in the 80s, but like, we're in a different time frame. It's a whole different time frame. And I think it's really important to remember when all of that was determined versus now, because sooner research, this was done in 2015, 10 years ago, just 10 years ago, not 40 years ago, but 10 years ago, it was determined that a observational study was done, and it was on all of the hunter-gatherer tribes. So there are still some tribes that live very primitively off the land. So if we take people who are not exposed to anything industrialized, they're living off the land, what does sleep look like and how many hours is required when we're looking at the population from that spectrum? Well, their natural sleep cycles, 5 to 6 hours, period. And the conclusion on that paper is that maybe 5 to 6 might be the standard, but we really need to do research for where we are now as a population. So it's possible and probable that Kevin Hart or Vince McMahon might actually, yes, they're purporting 4 to 5 hours is all you need. That might be all they need. Maybe other people need more. Sleep is varied. There's no one thing that works for all of us when it comes to sleep. What I will say is that we need to start looking at quality of sleep, okay? So time is not key. We're not looking for predetermined set number of hours that you're in the bed. I want quality output of sleep as your primary objective, all right? So bust that myth, okay? We're gonna use our last 15 minutes together to get into some this is a very long slide there to get into some coaching. Okay, so you're sitting chairside and you're looking at somebody who is very clearly struggling with sleep deprivation. You yourself might even identify with some of that. Well, now let's get into a little bit of coaching. Coaching is not as difficult as it may sound or as it may seem. There's a lot of books, there's a lot of courses, there's a lot of things, but I'll tell you that there are really only 4 keys to coaching, okay? If you can demonstrate these qualities, you're fine. You'll need to not buy any books, okay? If you can, be a good active listener. So when you're listening, you're just listening. You're not to impart any sort of judgment. You're not to be listening for an ability to respond to something. You're listening to actually take in what you are being told. Like, what's the information that you are receiving? Processing that, sitting with it, and then reflecting back to them with empathy. So you've heard this. This is what they're experiencing. Well, now you've got their perspective. Now you can look through their lens and from a point of empathy, really reflect back what it is that you're able to see or what you've heard so far. So you're reflecting back. Then you want to ask questions from a point of curiosity. What is it about them that you would need to work with? So there are some people who are super stubborn. You know who they are. Like, you get them, they are in your chair. You've been talking to them about an electric toothbrush for so long, and they will never buy one. They only want a manual toothbrush. They're very traditional. They're stuck in their ways. They refuse to upgrade for a flip phone. Like, this is the way they are, rigid. Awesome. So I'm going to ask from a point of curiosity, are they willing to do XYZ instead of XYZ? They might not be willing to. What's their temperament? Like, if you can gauge that from building some rapport, you can ask really insightful questions to feed back from what they're giving you as far as their information. And then effectively communicate back to them afterwards, like what you've learned after your empathy, your curiosity, and your listening, like what exactly it is that you've learned. So if they're sitting across from you and they're telling you, hey, I've been struggling with sleep, I'm waking up in the middle of the night every night. I keep going to the bathroom. I don't know. I just think that if I just stop drinking before bed, it'll be fine. And then you reflect back to them, I'm really sorry to hear that. It must be very challenging to wake up so often in the middle of the night and have to utilize the bathroom. Are you open to some strategies that might be helpful? Because some information that I've learned is that sometimes there might be breathing disruptions in your sleep that are causing an influx of certain chemical receptors. And those chemical receptors are sending signals to your body that you've got too much sodium, and then it's asking your body to release it. Are you open to some strategies that might help to improve that? It will require a change in your lifestyle. And I don't want to change your lifestyle if that's not something you're open to. What's their response? I don't know. But we can go from there. Okay. So, very important that you're able to kind of work with them in a conversation. Here's some other communication strategies and things that we'll kind of go through. I think it's important that if you've been seeing people for a long time in the same practice, anytime you're introducing something new, people are always going to be a little skeptical. Like, you've never talked to me about sleep ever before. I don't understand why you're talking to me about it now. I've been seeing you for the last 10 years, Janine. Like, why? Why now? Well, I am a provider who is licensed, and I have requirements for continuing education. I go above and beyond those requirements, and I'm always looking to provide you the highest standard of care. And the highest standard of care currently, as per my associations or whatever it is you want to reference, but the highest standard of care is to start screening for sleep and to start having these conversations. And I understand that it's new, and because it's new, I'm going to give you a little space from it. I have some resources for you. Like, I'm going to give you some things that will help you to kind of guide you along, right? And in that way, you can kind of coax those people who don't like change, who are very resistant to it, who don't want to hear anything new that you have to present. You can coax and guide them along your way. Okay. You're going to ask them as many questions as you can, just kind of get where they're going. Are they open? And I think it's really important to offer a quick win. Offering a quick win is the best thing I've ever learned, and I think it can be incredibly helpful for you too. Not everything has to be behind some sort of paywall. It doesn't have to be, hey, if you sign up for my myofunctional therapy program, I'll help you with what. No. If you sign up for our sleep program, if you get the doctor's night guard, if you get this appliance, then yay. No. I think you win more flies with honey every single time. Consistently, you will win more flies with honey every time. So offer them something that is going to help them succeed. After you've given them something to succeed, they might want then more honey. So if you've given them a trick, a tool, an exercise, a resource, they'll come back for more. You have now proven that you are trustworthy. You've given them something that it was good, and they're going to, in turn, want to do whatever is next and or be more likely to listen to you the next time, right? So follow these communication strategies, definitely offer a quick win, but don't be afraid to watch and see sometimes too, okay? We'll get to watch and see in a second. I just want to talk about some quick wins. Sometimes the myo nozzle might be it, just telling them that they can get this thing and it'll be something that'll help just a little. It's 2%. It's 2% of a greater picture of muscles and function, but you would rather they have something and work the tongue than do nothing, right? Or nasal hygiene. I'd rather you really create a routine around this. You complaining about congestion, you sit here, you mouth breathe, you fog up my mirror. I can't get my job done the way that I need to get it done. Then this is what I need you to do. Nasal hygiene. You got to clean out your nose, help to keep those sinuses nice and clear. So provide them some nasal hygiene. The Manditrack was actually a really, really great functional orthotic. I can't tell you the amount of times I find ways to put a Manditrack in a myofunctional therapy program, and I just get a win every time. Like, it doesn't matter what it is. Habit elimination, I've started adding it to TMD. It's always great. Sleep is a really great worker for the pharyngeal muscles and the genioglossus. Like, and just getting that forward protrusion of the jaw. Manditrack is fabulous, but offer them a tool. All of these things, I was just gonna say, all of these things under $35. Probably not. All of these things under $50. Okay. All of these things under $50, quick wins and things that they can go and, either buy in your office. That would be like the Manditrack or maybe the Myonozzle, or buy on their own the Myonozzle, this nasal hygiene things. But remind them that it's all about breathing. It's all about breathing. So even if they do nothing more than a nasal strip or a nasal dilator, that's what it is, or a nasal dilator. I just want to call it a nasal cone, or they want to do a nasal dilator, then do something. Even if they tell you, like, oh, okay, I'll look into mouth taping. If that's something you want to offer them, offer that. But, they need to do something, and then they can start to track their sleep by themselves. Everybody has a method of tracking their sleep, or most people, I should say. I don't own any smartwatches. I don't believe in having extra electromagnetic frequency on my body, but there's plenty of people who do have the watches, and those who do have those watches, these watches are FDA approved in 2024. They were FDA approved for sleep screening. You can screen your sleep at home yourself. You don't need a fancy app. You don't need to pay for a membership. You don't need a home sleep test. You need your Apple Watch or your Android watch or whatever. You need your smartwatch. Put that on, and from there, watch the quality of your sleep. Try the different methods. Do nasal hygiene and see if it helps to improve your sleep. Use the Manotrack, see if it helps you improve your sleep. Use the Replenish, see if it helps to improve your sleep. You've got a sleep screener on your arm, sir or ma'am. Like, it's there. It's already there. And so they can do the things, make sure that they're getting the restorative sleep that they need. Okay. I think this slide is really, really good. Just do a screenshot of it. It's really, I love this slide. This is a slide from a particular course. I'm not going to tell you where I taught this, but this is a slide from a particular course, and it's, I think, good stuff. I'm going to move away from the slide now, guys. So if you didn't get a screenshot, tell me after, and I'll help. Okay. Let's talk about some quick exercises that you can give as like a short win, because everybody, the first thing that they will do if you start talking to them about myofunctional therapy is they'll go online and they'll start trying to figure it out themselves. So give them something that works and is reliable. Monkey mouth, I don't know what everybody else calls it, but I call it monkey mouth. Fill up the mouth with air before sleep. I want you to nasal breathe, and I want you to try to maintain it for as long as you can. Work your way up to a goal of 2 minutes. And once you've mastered 2 minutes, work your way up to a goal of 4. I've never had anybody go over 4, but typically if you can hold pressurized air behind your lips for 4 minutes, you can maintain a lip seal. Okay. You can get a little bit stronger at that lip seal and some of that open mouth breathing. That might be your natural mouth tape. So sometimes those droolers at night, I give them that, like, hey, just do this before bed. Nothing else. Nothing else. Like, that might be during a consultation. I'll give somebody that just as like, here's a quick win. And then they'll call me and be like, hey, oh my gosh, that was really, really helpful. I think I want to do the evaluation because I think there's more here. Quiet breathing. I do that with a, I wish I had one. I do that with a tongue depressor. I don't have it on me. It's literally on the other side of the room. Okay. A tongue depressor horizontally under the tongue, between the lips, teeth never bite on it, nasal breathing. Increasing that lip strength by holding the stick. The tongue is up on it like a ramp, held up against the spot in the incisive papilla and the first third of the palate, really. They're going to get a passive swallow in that. They're going to get the teeth in the freeway space because it's slightly apart. It's just gold. I just love it. And then uvula trampolines. We want to elevate the uvula. You can tell them to open wide, use a cell phone if they need to. They could just do the illumination of the oral cavity and then lift it up and get engagement. You could do gargling. There's so many things you can do, but give them something, a short win, something. Okay. Most importantly, just make sure that they're doing one of these 4 things: being consistent with their sleep, managing their airway, nasal hygiene, make sure they're opening it up, like they're managing their airway, relaxing before bed. That's the best way to get into stage 1 sleep, is by getting into a bit of relaxation, and being efficient when they wake up, like expose yourself to sunlight as soon as you can. Really helpful. Okay. For triaging care, if you're a hygienist and you're just in office, or if you are a myofunctional therapist and you're not sure where exactly you want to send them, or if they need a full program, or what you want to do, or if they're even going to come back after the consultation, if they have an immediate need, they need to get something. So if you know that they're really bad off and they really need what you have to offer, you can refer them to an ENT, a sleep physician, like somebody who really does sleep and might do it under the insurance. You can give them a recommended exercise or a tool. You can provide them with resources. We'll talk about resources in just a second. Or those with lesser needs, it's more of a watch and wait. So you'll get the information by, just kind of telling them what to pay attention to, what they should focus on, and what resources to absorb. Okay. So watch and wait is really those people who are very resistant to change and don't really want to hear whatever it is you have to say, because they're just over it. They're just like, oh my gosh, she just learned something else, or she's trying to implement something else. I don't need this. There may be a watch and wait. Like, I'm totally okay with just seeing if anything changes. And I want you to see if anything changes too, Mr. Jones. And, this is what we're looking for. Resources. All of these are really great books. I'm just rushing through the end here. All of these are really great books. I think it's really important, though, that you curate your own list. If you don't have your own list in the office that you work in, please acquire a list. So you can put together a list and you can put that on like a Google document. You can put it on really anything, but you can put it in like a Word document. You can put it in a Dropbox or whatever, and then have a QR code. And then they scan the QR code right from your op or right at your desk or whatever to get more information. Or you can have a preset email that you type in. So if you use a mail server like Kit or MailChimp, you can have a preset email and you type in their email into your entry form, and they automatically get an email and they're subscribed to your newsletter, and they might get a series of emails with more education and more resources or whatever. But have something that you can give them. That way they can walk away with the information. Don't just tell them like, hey, you should read Breathe by James Nestor. Breath. You should read Breath by James Nestor. Okay, because as soon as you told me that and I walk out that door, I've already forgotten and I no longer care. Like, I moved on to the next thing. So if you have something that they can scan or can actually leave with, hold, like if you have a sheet of paper, like have a resource that they can actively utilize. I think that's the best way to get everything together, because a lot of times, you're walking out of a place and you're, oh, this paper. And you got to find something to do with the paper. Or you have to find something to do with that link, or you have to close out whatever window. Like, they're going to be able to see it again, reference it again, and maybe dive deeper. Okay. All right. I want to thank you. I have some information. If anybody has questions, please put them in the chat, or you can unmute at this point. But I want to take a second for a shameless plug before I give you the code. So, shameless plug. This week, literally today, every Thursday, there's a new episode of this podcast now. I have a new podcast. It's the Myo Moment. I am a much better podcast guest than I am host. And so it's a struggle these first couple of episodes, but my guests are fabulous. This week, we have our board treasurer, Tierney Midkiff, and Tierney is fabulous. Everybody who is a guest on this show is talking about one case and the way how Myo really helped to change or transform the life of one person. And so if you are interested in being a guest, reach out to me. Always happy to have you as a guest. I have a form literally on that website, themyomoment.com. So if you're interested, so you can learn more, listen at themyomoment.com, or apply to be a guest. But with that, I'm just going to leave this little thank you screen up here for just a second. That way you can get any of my information. I do see something in the chat. Let's see. What's a MandaTrack? Where to find this wonderful device? MandaTrack is sold by Dynaflex. Hold on, I have one. Hold on. I know everybody's gonna be like, where's the code? Sorry, I have to do everything. I have to get the code. I have to whatever. Okay, really quick. MandaTrack, this wonderful appliance. Now, MandaTrack is sold by Dynaflex. Dynaflex is a lab or like a appliance distributor, but MandaTrack essentially has these aligner tray seaters on this plastic U-shaped device, and then there's 3 different exercises that you can do with it, but it is absolutely fabulous. I have a video on YouTube. Maybe I'll share that video when I send out the CE for the event. That way, you know, I don't make too many people mad by not sharing this code. Hold on, I gotta get the code, guys. It's been fabulous being with you guys. Let me get back to my code. There we go. So the code is real. Hold on. It's going in the chat now. And there it is. There we go. Awesome, guys. It's been a pleasure being with you this evening. If you have any other questions, feel free to reach out to me at any point in time. I am available at info, INFO, at myiaah.org. Thanks, guys. Thanks, Beth. Thanks, Amy. Thanks, Faith. Thanks, Stephanie. Thanks, Carol. Thank you guys for being here. Please allow me 48 hours for the CE certificates, but I'll see you guys next time. Bye.